difficult. Well, joining me now is Dr. Adam Brown, emergency physician and chair of the COVID-19 National Task Force at Envision Healthcare. Thank you so much for joining us, Doctor. I think yesterday with the death of Colin Powell, it's good to have you. The death of Colin Powell really brought this issue to light, where if you have a serious illness and you've had the vaccine, it may not work for you. A sad day, like I said, for the country. How do you know whether or not you're in that position? Because there's a lot of people who have different underlying conditions. They may have a type of cancer. It may be in remission. It may not be. And the vaccine simply won't work. Is that the case across the board?
Well, no, and I think it's an excellent question and a point to bring up. First, my condolences go out to the Powell family and, of course, to friends and colleagues. Such a mighty person in the country and also the world. But his death also brings up a very important point about the importance of vaccination. Now, one may say, well, he was vaccinated, so why did he pass from COVID-19? Secretary Powell was probably one of the most vulnerable individuals that we have when we look at people within the country that are vulnerable to COVID-19, even vaccinated individuals with COVID-19. Because he was A, elderly, B, he also had cancer, and he had a type of cancer that affected his immune system, his blood, and affected the immune system. And some of the treatments for that cancer also cause modifications with the immune response that the body may have to vaccines. So when you're looking across the board at are vaccines effective, yes, they're still more than 90% effective at preventing severe illness, hospitalizations, and deaths. But there are some small percentage of the population with these really severe diseases, especially those that cause immunocompromised states, that cause the vaccines not to be quite as effective. So I don't want this information to get to people to think, hey, I don't need to get vaccinated because they don't work. No, you definitely need to get vaccinated because you may be protecting the most vulnerable, like Secretary Powell.
Well, doctor, some of the reports said that he was about to get a third shot, the booster shot. So why were they going to give him a third shot if what you're telling me is that, because of his situation, his age and the illness, that the vaccine really can't help in that situation? Or would the third vaccine have perhaps kept him alive?
Well, the answer is yes to the latter point. So here's the issue with vaccines. So vaccines, when they're given, they cause the body to have an immune response. And depending on the person, depending on whether or not they have an underlying immune compromised state, well, the body will respond slightly differently. And so in Secretary Powell's state, because he was immunocompromised, having 2 doses of vaccine was not enough to really get the immune response that was needed to prevent infection. And so in some cases, and this is one of the reasons why the FDA and the CDC came out, is that for vulnerable populations, those over the age of 65, those with underlying health conditions, that it's important to get a booster shot to really increase the amount of immune response that one has. Just to the first point, though, is the vaccine does still work with immunocompromised patients. It's just not quite as effective. One study that came out in July said that it was about 45% effective for someone who's been fully vaccinated, and that just isn't enough. And so that's one of the reasons why a booster dose is really necessary for those patient populations. For the general population, for younger individuals or those that don't have those severe concerns, it appears thus far that 2 doses of the vaccine are still very good at preventing severe illness and death. But for those other populations, a booster is needed.
Yes, certainly understandable. Okay, the last thing I want to ask you about, doctor, is about the body building up natural immunity after getting COVID. Can people with severe health conditions build up natural immunity? And if so, will it last in these patients?
So it's a very similar type of situation. So the body does have a natural immune response when we get an infection. But those who are elderly or those who have underlying healthcare conditions that cause them to be immunocompromised may not have the same level of immune response. And so it's pretty unpredictable. So that's one of the reasons why getting vaccinated and following the science of vaccines and seeing where antibody responses are is a way that there's a little more predictability in ensuring that someone is immunized against an infection. And so, one thing we do not want people to do is to say, you know what, instead of getting vaccinated, I'm just going to wait until I get COVID. That's a bad, bad choice. Because we do know is that there's a number of individuals, about a third, that will get long COVID symptoms. And we also know that there's death associated with that. And so, we'd rather people to get vaccinated, and especially in those high risk type of communities, to get boosted. And for those who are hesitant and who are on the fence, think about the people you're going to be interacting with over the holiday season, because you may be protecting them from getting ill when their body may not respond as strongly to a vaccine. So get out there and get vaccinated. Still extremely.
Well, thank you so much for that advice, and thank you so much for all you do as a physician. I'm sure the emergency room has been busier than ever. We appreciate what you do as a frontline worker. Thanks for being with us. And during this pandemic, we've talked a lot about the role, of course, of doctors, nurses, and all of those healthcare professionals that are out there trying to keep us safe. But the pandemic is also highlighting the need for more social workers. They provide, of course,